Welcome, everyone. Like we said, our title tonight is AI inside the Operatory, powering better care and efficiency. You've got two excellent speakers with you tonight. Annie Peters and I have been lecturing together for, probably the better part of a year now and have a lot of fun doing this. So appreciate you guys being here with us tonight, and let's go ahead and dive in.
Perfect. So we want to touch on a few of our learning objectives for you guys tonight. The first one's going to be sharper diagnostics. So we want to see how AI acts as your second opinion for better radiograph interpretation, helping spot areas of concern for greater diagnostic confidence.
We're also going to redefine dental caries treatment. We're going to have a lot of fun reviewing dental caries processes and uncovering a breakthrough non-invasive treatment for early carious lesions to help our patients avoid the dreaded drill.
The dreaded drills, right. The third objective is going to be visual trust builders. So we want to see how AI helps patients understand their conditions, recognizing the value of treatment, and at the end, say yes to their treatment.
And to wrap it all up, we want to make things really work for you and work for your practice. We're going to hope that you can take all the different tips and tricks and tools and everything we go over to help you elevate your practice, streamline your processes, and offer better, more efficient patient care without adding layers of complexity or time, because nobody's got time for that in the real world, right, Annie?
Right. So to kick it off here, how is our industry leveraging AI, right? And what is available to you today? So radiographic analysis offers hygienists and dentists a clear, user-friendly interface that shows the results of AI analysis in real time. So making dental conditions easier for patients to understand. Clinical AI is a tool that's going to help educate your patients, mostly about their oral health care in a more visual, interactive way. It bridges the gap between the dentist expertise and the patient's understanding. So making that complex dental concepts more understanding. And for any of our pediatric dentists that we have on the call, or for any of you that see children, you'll be happy to learn that the clinical AI on x-rays is helping pediatric dentists prioritize oral health and treatment for those children ages 3 years and older. So thanks to the new FDA cleared AI approval, where you can spot potential caries forming, not just on primary teeth, but on secondary teeth. I'm sure, Lisa, you can speak to this, but parents are loving this.
Yeah, I was just thinking in my head, they always say a picture's worth 1,000 words. And I got to say, as a clinical dental hygienist who gets to work with AI in three different practices, AI isn't worth 1,000 words. AI is worth millions of words. I really have to spend less time explaining all the different aspects of radiographs and my findings from bone levels to caries when a patient can actually see what I see and help with the different types of diagnostic tools that AI is able to help guide me in better conversations with my patients.
Right. I
This
love
is what I
that.
was talking about. Yeah, the see what we see. Yeah.
Exactly. Yes. So, how do we get patients to better understand their issues, address their concerns, and build trust so that they say yes to your treatment plans? Well, one way is very easy is we want to teach them to see what you're seeing on that x-ray. It's human nature, guilty of this. People love to learn, right? That's going to include your patient base. They want to learn and they want to know and see what you're seeing so they can better understand um, what direction you're taking them for their treatment plans. So on the left here, you can see this is the clinical view or the clinician's view of an x-ray showing where AI was used to identify potential issues on these teeth. On the right-hand screen, it's the same image, but it's being presented in a patient-friendly format. So this is going to help the patient focus on those red areas or the yellow dots on there for those bone level numbers, right? So this is going to help you as a practitioner to start that treatment planning conversation and allow that patient to follow along with you. Okay. I know, Lisa, you probably get a lot of like head bobs usually if you don't have this tool in your operatory of, yeah, people are listening, but they're not quite grasping and understanding what it is that you're showing them.
Oh, a thousand
Uh,
percent. I don't know if anybody on this webinar tonight has ever had a patient be really practically honest with them. But as I'm going through these x-rays that clearly in my mind, I can see radio opacities and lucencies, and to me, those x-rays look like teeth. But when I've ever asked a patient, do you see what I'm talking about here? And I'm pointing to all these little areas. Has anybody's patient ever been so honest to tell you that they say, no, I don't see what you're talking about because what I'm looking at is it looks like toes. So
mhm.
I don't know if you guys have heard your patients say that before, but they think dental x-rays look like toes. And I'm sitting here trying to explain what a radiolucency is and why they need to spend X amount of dollars on one tooth that needs a crown and why a different tooth needs a filling. And then I'm talking about the difference of bone loss versus not bone loss. And when you can go into that patient view there on that right side, and I can just use the color schematics with the patient. And when I'm talking about bone levels, say, hey, all these orange and red dots, these are areas where you have permanently lost your attachment, your bone level around your teeth. And if we don't do XYZ, you're going to end up with more of these orange, yellow, and red lines. I mean, and looking at this, the dental caries conversation just gets cut in half. That's why I say AI is worth a million words. All we have to do is add up the oranges and the yellows and the reds, and it really helps the patient understand why different teeth need different types of treatment. Almost, like a second opinion, almost like, oh, okay, I kind of trust the dentist, but the last dentist I went to burned me. So, like they're a little skeptical, but when they can see it in real time, real view, it really helps build that trust and honesty conversation.
Agreed. Yes. And you can imagine too, is when you're presenting this type of an image to a patient, it's going to be easier for them to understand that, areas that we're watching are areas that we're treating and inevitably get the treatment done sooner. So here I have a picture of the patient education tools within Videa Health. So that's who we've partnered with under Dentrix Ascend. And this is where AI really shines. So it's not just detecting conditions like bone loss and caries, but it in how we communicate those findings. Okay, so with this image, the problem areas are clearly marked. This is going to help your patients visually connect with what you're explaining. We also provide a QR code there. You can see that on the right-hand side of the screen. That's going to allow your patient to scan that image and access their personal report later on in the evening or the next morning when it's really sinking in your words and what you were explaining to them at their appointment. So the education doesn't stop when they leave the operatory. The step-by-step treatment plan, I have that in the upper right-hand corner. This is what's going to make it easier for your patients to understand what's next and why it matters. It's a simple, tech-driven way to improve clarity, reduce hesitation, and ultimately increase your case acceptance. So going back to that chairside conversation, taking that AI analysis, it also creates a shareable patient record. So I mentioned on the slide before with that QR code, this is going to be their patient record, which is going to serve as an extension of that conversation. So these reports are going to summarize findings in a way that patients can actually understand, right? We're not going to have any technical jargon in there. It's just a nice, clean, clear visual of that particular image with those particular teeth numbers on there. And so you can see here on the right, I zoomed in on tooth number 3, 4, and 5. And I really wanted to draw attention to tooth number 5 because it's showing the bone level as mild, which is it's going to be a yellow dotted line, like Lisa had mentioned on the previous slide. And that's indicating that that's a mild number for that patient. It's also going to give you that percentage of tooth damage. This is going to be helpful. You could use this on your insurance claims as well, right? And your case presentation on how much percentage of that tooth is actually damaged. So I feel, and I'm sure Lisa that you could relate to this too, but I feel this is extremely helpful when diagnosing periodontal disease.
Yeah, that and tooth damage too, like you said. I mean, it's
Yeah.
almost like a report card. it's a patient report card that they can take home and say, "Ooh, if I don't change my habits and do what this dental professional told me to do, I'm going to continue to have all these red, orange, yellow problems, which are going to cost me more money down the line." And I can imagine, I haven't used this patient report before, but I can just imagine that, if every time they come see me, they get this report card, it's a motivational tool for some to
It
say,
is.
"Ooh, do I have less of those red spots? Do I have less
Mhm.
of the yellow mild bone loss that you're talking about?"
Yes, gold star. Take a toy
Right.
from the treasure the treasure box. So here on the screen also is a list of the pathologies that are detected by AI current day. So caries detection, as I mentioned before, ages 3 and older. We have caries detections on anterior teeth, on periapricals. We've got interproximal calculus detections, 12 years and older. We have periapical radiolucency detection, ages 22 and older. We've got RBL measurements, restoration imperfections. It's going to be those crowns, fillings, margins there. In addition to that, I did want to note that having the FDA clearance on your images, that also provides a level of legal protection to practitioners that are using this AI tool. So, as you are relying on technology that meets federal health standards, this can be especially important in cases where treatment outcomes maybe are contested. So the FDA clearance ensures that the AI tool meets the necessary standards for accuracy, reliability, and safety for that dental diagnosis.
And I bet that would be a trust builder with patients too. Anytime I'm presenting something that is new to them or something, "Oh, y'all changed something, right?"
Yeah,
Anytime you can say, "Yes, this is FDA cleared," like your slide says here, that's a trust builder with the patient too. They're like, "Oh, okay, wait. So this is something that is happening throughout the United States, and even at a federal level, they're overseeing it." So that's a helpful bonus
correct.
too.
It is, and it provides a level of comfort too.
Yeah, no, absolutely. And just kind of piggybacking off of that, I love the fact that you shared all the different types of tissue damage and loss and things that can happen with teeth. And let's just be honest, as healthcare providers here in the United States, we really deal with a lot of tooth damage. The US incidence and prevalence of dental caries has not declined since 1990. 1 in 4 adult
Okay.
Americans has existing decay in their teeth right now. And hear this stat, 1 in 2 or 50% of all the adolescents and children in the United States, in a first world country with all the GDP dollars that we have for healthcare, are walking around with active caries in both permanent and primary teeth. It's a pretty sad statistic given the resources we really do have in dentistry to help fight this battle here that we're really just not winning. And it's telling me that the resources that we do have, the interventions that we're using in our field, if we haven't made a dent in the incidence and prevalence of dental caries since 1990, it's just saying that our preventive measures are being outweighed by the risk factors that people are walking around with for dental caries. What you guys are looking at here on the screen is the
Mhm.
American Dental Association's current existing risk factors for dental caries. Dental caries is a very complex disease process. It is biofilm mediated, so we have to have bacteria in the mouth that munch away the fermentable carbohydrates and they secrete lactic, formic, and acetic acid into the mouth. That causes the demineralization that you see on my patient here. This is actually a 16-year-old adolescent patient, and what caused most of her
Wow.
decay was what I call non-modifiable factors. And if you're looking at this graph as I'm speaking, you'll start noticing that some of these things on this list are modifiable, meaning I can change somebody's oral hygiene habits. I can teach them how to brush better. But what I can't change is their genetic predisposition. That's a non-modifiable factor for dental caries. I can't always fight their salivary composition, how much biofilm they truly get, which makes the mouth even more dysbiotic. I can't get rid of their systemic diseases or take them off life-saving medications that they're on. So it's a very multifactorial disease. And when we sit with patients in our practice and we flip on that AI and I start seeing bing, 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 bing all over the place, we've got dental caries starting in every quadrant of the mouth. It's not surprising because dental caries is not tooth specific. So, what actually caused my patients' decay rates here was child neglect and abuse. So, CPS stepped in and took this individual away from a mom and dad who were not the best parents to her. Grandma brought her in for her first appointment ever to the dentist at 16, and this is what her teeth looked like. This isn't the only patient I've ever seen that looks like this, but this battle that we're fighting with dental caries in this country, we really just aren't weaponized with the right tools to bring to this battle. I don't have all the tools necessary to combat third from the top here on the graph, behavioral patterns of the American diet that's high in sugars, it's high in acids, our habits like tobacco, alcohol, and drug use. This is a predominating problem in this country, and we need better tools to come at the dental caries risk factors than currently what we have, because what we have, we're just losing the battle. So Annie, let me ask you, when you have patients that present, not like my 16-year-old on the previous page, but let's kind of look at what the arrows on the radiograph and the demineralization, as
Mhm.
you can see around these ortho bracket bands here. In your clinical experience, how do offices that you've worked at currently treat what we would call early stage caries lesions, these lesions that are still inside the enamel? What's the go-to?
Go to first, I would probably say we would watch it, right? We would
Okay.
keep an eye on those areas or some sort of fluoride treatment of varnish.
Okay. So definitely not a drill and fill situation, right? That would be slightly
Correct.
unethical because what we're hoping is
Right.
that we can have natural remineralization. I mean, that would be the goal, that would be the hope.
Mhm.
Unfortunately, less than a third of teeth do repair themselves through natural remineralization. So 66 to 70% of all the other teeth are just going to keep progressing deeper into the enamel,
Mhm.
busting through the DEJ, and now all of a sudden we have to drill and fill. I mean, in my experience with watches, after being a dental hygienist for 25 years, what am I watching the tooth do? I'm watching it walk from early carious lesions into
Yep.
moderate to advanced. I'm waiting long enough where the dentist doesn't feel ethically immoral by treatment planning a drill fill procedure. That's all we're waiting and watching till we just feel comfortable enough to drill. And while that's a treatment approach that we've had in this country, I mean, we really didn't have a lot of other resources. You mentioned fluoride. Fluoride, fantastic
Mhm.
medicament for the prevention of caries. The problem with these two situations is that these patients have caries. And by the time a dental caries is going to pop on an x-ray, a two-dimensional picture of a three-dimensional object, you've got a pretty significant amount of demineralization. In a Cochrane review, they said anywhere between 30 to 40% of demineralization into the enamel has occurred by the time we even catch it on an x-ray. So the problem with fluoride, it's like if fluoride solved all of our problems, it would have already solved all our problems. The problem is that the poor fluoride, whether it's varnish or foams or gels or whatever you're using, is a superficial surface level treatment. It can't penetrate more than about 20 to 40 mu meters, so a millionth of a meter, into that enamel
Mhm.
surface. And you got to get down to the depth and the base of the lesion to heal it from the inside out. So poor fluoride is just you're taking a butter knife to war is what you're doing, right? And what we need are guns coming to this war. And so really for the first time in history in the United States, we finally have a solution for the treatment of early dental carious lesions with a procedure called guided enamel repair. This procedure is performed with Curodont Repair Fluoride Plus, as you can see pictured here on the screen and kind of listed in blue there in the middle of the slide. Curodont Repair Fluoride Plus, for those who don't know, is a biomimetic solution, meaning it's a medicament that synthesizes a similar product by artificial mechanisms that mimic some sort of natural body process. In guided enamel repair, we're talking about synthesizing the building blocks of enamel. Histologically, enamel is made up of 96% hydroxyapatite. It is a highly mineralized structure and, as such, is unable to repair itself when early carious lesions begin. Curodont Repair Fluoride Plus is able to synthesize hydroxyapatite and put back what I tell my patients Mother Nature took away through the demineralization process. It works on all enamel surfaces, so whether that's occlusal, like you see pictured here on the top right, interproximal, so you see that in the bottom right image, applying Curodont Repair Fluoride Plus into that embouchure space, and it can be used on all smooth surfaces. So that orthodontic patient that I was just showing you, Annie, is a patient that did undergo
Mhm.
guided enamel repair, and they were able to avoid debanding that kiddo and taking off the braces and able to heal up those demineralized areas with a one-time application. The beauty of Curodont Repair Fluoride Plus is that it's tasteless. It is suitable for all age patients, including children. And the best part about it, as a dental hygienist, is it doesn't stain teeth. So really, the only way I ever know which teeth I applied this solution on, you have to chart it. Just like you would a filling or a sealant or anything else like that, you got to have a charting for this procedure. The American Dental Association does have a code for this procedure that you can find. The year it was released was 2024. So in your 2024 and 2025 CDT manuals, there is a code for this procedure. Guided enamel repair is a fast, non-invasive, drill-free procedure that is easy to incorporate into any appointment. This is a pretty cool slide that I'm sure you'll appreciate, uh, people on this webinar, especially as dental providers. And Annie, I'm sure you appreciate it as well. This is a recent in vitro study that was conducted on Curodont Repair Fluoride Plus to determine its effects on lab simulated carious lesions. You're looking at micro CT and scanning electron microscopy that was used in the study. At the top image is the artificial caries, and the bottom is the post Curodont Repair Fluoride Plus image. And if you just look at that, as you can see, the Curodont Repair Fluoride Plus significantly increased the hydroxyapatite mineral density throughout the depth of the carious lesions, which, like I said, is truly where you need repair to treat this carious disease. And in the end, the Curodont Repair Fluoride Plus images show larger hydroxyapatite crystals than the control. And this is just an animation really showing you the difference between surface level medicaments. So unlike a preventive solution, like you were mentioning fluoride or calcium phosphate products that really only have a surface level penetration, like I said, typically no more than 20 to 40 millimeters into the tooth surface, Curodont Repair Fluoride Plus on the right diffuses throughout the depth of the lesion, and over time, together with calcium and phosphate, repairs lesions, making Curodont Repair Fluoride Plus a true treatment for early carious lesions as opposed to a preventive medicament like fluoride or ACP. And this is really important to explain to patients, you guys. You've got to use these words, the two buzzwords I use, and I use my hands. I tell my patients, hey, you've got early carious lesions. Here's the spots on the AI that we found today. But lucky you, these lesions are not through the enamel yet. So we can actually treat, there's the word, treat the carious lesion with this new procedure called guided enamel repair. Then, because you got these lesions and you are moderate to high risk on your Cambra Caries rating score, I need you to use these preventive agents. I need you to allow me to put varnish on your teeth. I need you to take home this at-home product that has extra strength fluoride, or it's got, calcium or phosphate or hydroxyapatite, whatever it is you guys are using for prevention. Patients need to understand the distinguisher between the two. And if we can get control of the preventive measures, and if we can make the prevention outweigh the risk factors, You don't need to have lesions treated in the future. So there's your two big buzzwords I want you guys to take away after today. You have treatment for dental caries, you have prevention for dental caries, and they are two completely different entities. So, guided enamel repair, and I like that you said this earlier, Annie. It bridges the
Mhm.
gap. I like this word too. You talked about bridging the gap. It really does bridge the gap between our current caries prevention methods. That's me putting fluoride varnish, by the way, on my 16-year-old's teeth. That's Braden's anterior teeth there. And that's also Braden's cavity prep that just occurred last year and the drill. So you can see how deep his caries went. And by the way, that lesion, you're looking at the interproximal lingual side of 7 and 8. That decay occurred in a 4 month period of time. Braden is one of those patients
Wow.
whose decay spreads deep and it spreads rampant and it goes quick. And he goes to the dentist every 4 months because he's such high caries risk. And I'm sure over your career you've seen Braden's in your practice, right? You've experienced
Definitely.
patients where they present with these watches like Annie was talking about, right? These
Mhm.
like small, incipient, oh, it's not through the enamel yet, let's put a watch on it lesions. And then what happens 6 months to a year later, you're like, whoa, this watch is almost endo, right? Braden almost needed a gingivectomy at 16 years old for
Wow.
how deep his caries went. For anybody who's not aware, Curodont Repair Fluoride Plus is a highly researched product. It's been researched over 25 years. This is not a new product in the world. It's just new to us in the United States. There are over 230 single-blinded, double-blinded RCTs. There's so much literature out there on this product that there are now systematic reviews. Our own American Dental Association published a systematic review and meta-analysis on Curodont in 2023. I'll show it to you on the next slide. And through all of those 230 independent research trials, we can say with certainty as a company that Curodont Repair Fluoride Plus has over a 90% success rate cumulatively over all of this literature. You guys, what in dentistry have you ever heard of that has over a 90% success rate? We very rarely say something like that in our field. We don't say it about root canals. Okay, dental implants might be the only thing where I tell my patients there's an over a 90% success rate with an implant taking and doing what we need it to do. But really, I mean, I'm putting fluoride varnish on my patients every time I see them. I'm telling them it's worth the money. This is why you need it, blah, 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 blah. But fluoride varnish doesn't have over a 90% success rate in remineralizing early carious lesions. I mean, if it did, we wouldn't have a caries rate problem in this country because I would imagine most of us are doing the same thing in our clinical practice. So here is the systematic review and meta-analysis. You can see the title right there. And I'm just going to read to you two quotes that come directly out of this publication. So I'm going to read it word for word. The author said, the effects of promoting caries arrest and decreasing lesion size suggest that peptide P11.4 is a viable treatment option for initial carious lesions alongside other evidence-based interventions. Here's the next quote that really gets me as a dental hygienist. It is a meaningful addition beyond the effect of behavior change and other preventive interventions. That's where I have the confidence to tell my patient there's caries treatment, there's caries prevention. And I got JADA backing up that statement that I'm giving to my patients. So here's just a close up of that publication and just showing you what the author's practical implications were. I just kind of made it bigger on the slide so you can read it. Curodont Repair
Mhm.
Fluoride Plus likely has clinically important effects on caries arrest and decreasing lesion size. CRFP is a promising treatment for initial carious lesions. So if this isn't something you've looked at before or you haven't used in your practice or maybe you've never even heard about, this would be a great first read. You can pull this up free online from the American Dental Association's website. You don't have to be a member to get this publication. And then the last case I really want to leave you guys with is one that touches my heart and hits really close to home. You guys are looking at my son, that's Braden Mayo, when he was, ooh, I don't know, 10 or 11. So on this day, Dr. Wynn is our family dentist. I've temped at his office pretty frequently. I've worked with him and known him for his entire dental career, so at least the last 15 years. And on this day, when Braden was 10 or 11, we had to do some fillings because, like I said, my son is high caries risk, always has been since the age of 4. He has been getting dental caries. He gets anywhere from 1 to 2 a year for his whole life. Well, on this day, Dr. Wynn extracted his maxillary primary canine teeth because we were trying to get him started in Invisalign. So that's the little green tooth thing he's holding, and that's why his smile looks so funny. His whole upper arch is numb. So
So
let me
cute.
fast forward. I think cute though. Okay. So let me fast forward to the age of 16. So, Dr. Wynn is treating both my kids. I wasn't working for him this day. I was a dental hygiene program director. I was in his waiting room on my computer, probably emailing faculty or putting something together. And he comes out to the waiting room and he's like, "Hey, Lisa, I need you to come back to the back and look at Braden's x-rays." And I'm like, "Oh, yes, I'm sure you do." There's always something on this poor kid, right? Whose mom is a dental hygienist and am his primary dental provider. And I was like, all right. And he goes, "I need you to come look at his x-rays and I need you not to cry." And let me tell you why he said that to me. Annie, what jumps out to you first?
Right? Obviously, just the how fast the progression went, right?
Crazy. 4 months. He gets x-rays every 4 to 6
4 months.
months. It kind of just depends on, how his teeth are looking. This was a 4 month. He wasn't overdue for his recall. His mom is me. He ain't gonna be overdue. So the lateral incisors should be really jumping out to you guys. If you look at the mesial of the lateral incisors and look at the depth of that decay, it was game over on those teeth. We are well through the DEJ and the dentin. And then when Dr. Wynn opened the mesial of the laterals, he got a direct view of the distal of the central incisors, and we were game over there too. In fact, you saw his cavity prep earlier. Here's just a reminder. That's how deep his cavity was between 7 and 8. But something I want to point out to you guys is if you look at the middle x-ray, and I want your eyes to go to the interproximal region between 8 and 9. So Dr. Wynn turns to me and he goes, "Lisa, we're game over on the laterals, probably the distal of the centrals too. I got to do fillings," which I really hate in a 16-year-old because what's Braden's fate with number 7 and 8 by the time he's my age and he's 47? Do you really think he's still going to be having those fillings? Absolutely not. He's probably going to be in crowns at that point. So that's really what makes me cry as his mother and his primary dental provider. Well, between 8 and 9, Dr. Wynn was kind of thinking. He's like, I'm not quite sure if that decay is through the DEJ yet. Hey, Lisa, have you ever heard of this procedure called guided enamel repair? Have you ever heard of Curodont? And I said, yeah, funny you mentioned that. My students actually apply Curodont to get out of dental hygiene school. So I had actually never placed Curodont before, and Dr. Wynn hadn't either. And he said, "Well, I just got my first box. It's in the closet. He's your kid. Like, you seem to know about the product. Why don't we give it a whirl and see what happens?" He's like, "I haven't done it on a patient yet, but this seems like a good starting point. If we can save him 2 more fillings in the most cosmetic zone of his mouth, let's do it." So me and Dr. Wynn get up, we go back to his office, we watch a video from Vavardis's website. It's about a minute and a half, and it shows us how to apply Cure Repair Fluoride Plus. Super easy. It's kind of like doing a sealant without the curing light. And the tooth doesn't have to be bone dry. So we watch the video. We're like, that's easy. We go back into the operatory. I kick his assistant out, and I'm his assistant in my street clothes. I'm working on my kid. So we apply Curodont Repair Fluoride Plus into the interproximal space of 8 and 9. Let me show you what 8 and 9 visually look like. So from the facial, not too bad, but if you look at the lingual, look at the interproximal space between 8 and 9. If you take an explorer along that mesial of both those teeth, your explorer is just jump, 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 jump. I mean, you can just feel the demineralization and the decreased pH of that area. So, yes, I cried the day we found these lesions. 6 months later, here's his post-op image after guided enamel repair. And then I even have a 1 year post-op after guided enamel repair all the way to the right. And you guys, at that 1 year post-op appointment, that is also a day I cried. That was the day I called Vivardis and said, I want to come work for you. Because for a kid who spent his entire life getting drilled and filled, and his decay runs rampant and very fast, for 1 year later to see complete caries stop, just the caries progression stop, halt dead in its tracks, and that these lesions haven't changed in all that time. They still haven't changed now. We're 2 years post-op. That's what made me cry the second time. And that's, I hope you guys and you remember Braden's story. I hope I've tugged at your heartstrings enough because I know you have people listening to this. You have Braden's in your practice. We have a lot of
Mhm.
them. They don't have to be teenagers, they can be adults as well. But, we have something now that we can bring to this battle of dental caries that actually is going to make a difference. That is going to be able to decrease the amount of restorative work that we need to do on patients. And just to leave you and tie back in kind of our AI concept here, this is the advantage I get of working in the practices that I work in, is looking at the left here, the dental hygienist from the United States submitted this case. This one's not mine. But in her office, they use AI like I do to assist in the detection of early carious lesions, also obviously using it for perio as well. Well, this patient doesn't have bone loss. This is an adolescent. What the dentist diagnosed, with looking at teeth with the AI off, with the AI on, you can clearly see the lesions here on the left-hand side of the screen. Number 4 was diagnosed as an E2 to a D1 lesion, which means that lesion has full enamel penetration and possibly a transition through the DEJ into the outer layer of dentin. Number 5, distal, is an E2, which means more than 50% penetration into the enamel of demineralization. And don't forget to look at the distal of number 30. That was an E1 lesion, which is isolated to the outer half of enamel. You know, like Annie said to her testament, when I asked her, what have you seen practices doing when you have these E1, E2, maybe even early D1 lesions where you're like, is it through the DEJ? Is it not? Kind of like Braden's 8 and 9. Was it through the DEJ? Was it not? Two-dimensional pictures of three-dimensional objects. Many times the decay is deeper by the time doctor gets in there than what they saw on the x-ray, which is a pretty common occurrence. Now we can turn to the patient and say, we can clearly see these lesions instead of just putting a watch or a wait and watch approach, maybe throwing some varnish on there and crossing your fingers that they're in the 1/3 of teeth that could naturally remineralize on their own. Now we have a procedure to offer. Now you're going to offer guided enamel repair for these patients, which is exactly what Anna Blake, as a dental hygienist, did. They recommended this procedure. Doctor diagnosed that guided enamel repair was indicated. The patient was treated one time with Curodont Repair Fluoride Plus, and the post-op image says it all on the right. The AI can no longer detect any lesions on number 30 and number 5. They're just gone. And then the lesion that was a little deeper, number 4, that was the one where doctor was diagnosing potentially maybe through the dentinal type of lesion, has regressed back to an E1, or an E2, just a more manageable situation. So this combination of being able to pair your AI technology with now a procedure that can create a difference for the patient, stop the carious process in its tracks so our patients don't have to go into invasive procedures and have their natural tooth completely destroyed through, drilling and filling procedures.
So Lisa, I have a question for you on that. Is it something like that you could just go in and apply while they're in their hygiene appointment, or do you typically have them back, or how easy is it to perform this procedure?
Yeah, I don't know how Anna did it, but I'll tell you with Braden, he was in for his regular 6 month appointment. It
Right?
takes a whole minute and a half to, if
Okay.
that, to actually perform guided enamel repair. So it's a very easy added on same day procedure, especially in the hygiene chair, because I already
Yeah.
cleaned the teeth. All the
Right.
biofilm's out of the way,
Okay.
the pellicel's gone. All you got to do is etch, dry, and then throw this medicament on. You're done in a minute and a half. Put your varnish on, send your patient home. So it's a
Love
very
it.
easy to add on same day treatment procedure for the
Okay.
patient, meaning they don't have to come back. And what a convenience factor for them.
Yeah, I agree.
Thank
That's
you
kind
for
of where
asking
what I was thinking about too, even moving on to, talking about treatment plans and what can you say as a provider, to get your patients to say yes to their treatment, being able just to easily add that on while they're in the chair. Yes, if somebody says that to me, yes, let's do that. I'm here for it. So I think that's great that it's so easy to add on. It wouldn't take a little, wouldn't take much time.
No, really it doesn't. And I'm, as I'm sure most dental hygienists listening in on this, good at preheating the patient, identifying these areas, having AI flipped on. I've already showed the patient what the oranges and reds and yellows and all the different
Mhm.
colors mean and likely what doctor might recommend. So when doctor does come in for the exam, we're ready to go. We're already got same day treatment accepted for Curodont. I just need the
Right. Yeah.
diagnosis for the doctor to do
Yeah.
it.
And they're seeing those colors on the image and probably having a little bit of a panic moment
They
of, oh my
are.
gosh, I'm going to have a feeling. I don't want to come back. I don't like to be numb. All of the things that our patients are experiencing, right? And then when you come
Yeah.
in and doctor comes in and tells them, we could just put this on very easily in a couple of minutes.
Yeah. Done. As over a
Done.
90% success rate of
Right.
being able to stop this carious process in its tracks and put back what Mother Nature took away. You get a second chance on this
Mm-hmm.
tooth to not have a cavity. And that's all it
Perfect.
takes. Honestly,
Yeah.
three sentences and you're done.
Nice. I like it. So, um, let's get into talking about some communication strategies, right? So this is what we've tried and tested with a lot of different providers that we've been working with. I kind of put together some simple communication strategies for you guys. So number one is to use simple visual language, right? You've seen a lot of the AI in tonight's presentation, and instead of using technical jargon, right? Dentists describe AI findings in every terms. Very, very simple. For example, saying this area shows early tooth decay rather than incipient caries. Visual aids like highlighted images help patients see what you see. So tying that back to that slide in the very beginning, teaching those patients to see what you see. You want to frame AI as a support tool. Okay, so make sure you emphasize that the artificial intelligence on that x ray is a second set of eyes. So we're not replacing your expertise, but enhancing accuracy and consistency. This is going to reassure your patients that decisions are thorough, right, and carefully checked. Engage with
Yeah.
your
So
patients. Yes,
instead of
please.
looking at toes,
Yes.
they're looking at colors.
Yes, right. They're seeing toes. We need them to see
They're
teeth.
seeing toes. That is not helpful for me whatsoever. I probably have some patients just be honest and say all this stuff you're pointing to,
Yeah,
I don't even know. I'm just assuming you're telling me the correct and being
right.
trustworthy because I really don't see what you see.
That's so funny. And I've never heard of that before until I started presenting with you. And you said that in one of our first presentations. It was so funny. Now I can't not see toes in the
Right,
images.
right. Now, my husband was the first person to tell me that. He's like, all this stuff you're pointing at, he's like, honestly, that just looks like toes. Why
It's
are
so
you even
funny.
showing your patients that?
Yeah, right. Like, sweet. The third point I want to bring up too is engaging patients with interactive elements. So using features like that QR code that I showed earlier, or those digital report cards, is going to encourage your patients to review findings on their own time, and maybe even potentially share with their family members. So this kind of ongoing engagement is going to increase understanding and comfort and recommendations for those treatment plans.
Mhm.
The second to the last is explain the why. Explain the why behind the treatment plan, right? Step by step explanations paired with the AI images is going to help patients understand the necessity of each procedure. It's going to shift conversations from, do I have to? Are you sure? To, this will help because. And then lastly is please invite questions and validate their concerns. Dentists that I've personally worked with, they find success by encouraging patients to ask questions and expressing empathy for their concern. Right? This is going to help build rapport and reduce hesitation that's rooted in fear or misunderstanding in the treatment plan that you're presenting to them.
Yeah, like I always tell my students, there's no silly question. I mean, I guess there are in the world of universe, but in the world of
Yeah.
dentistry, there are no silly questions. And it is shocking to me some of the questions that patients do give you, and you're like, oh,
Yeah.
I would never have thought of that. I would never have thought that this word I
Right.
use has a totally different meaning to you than
Mm-hmm.
what I really truly mean it, and it's surprising sometimes our language can be very challenging for them as well. I liked how you said the word incipient. That's not like a common word that a lot of people know. I mean, I even have patients that don't know the word caries. If I don't
Yeah,
call it a
true.
cavity,
Yeah.
they may not know what that means. So I like the AI can come in, and what I also like about the AI is the dentist can come in and go, oh yeah, I know AI picked that up, but this is something else. I'm not worried about that. And they'll just like pop off the different colorations that the AI may have detected, because the AI is going to
Mm.
detect everything. It's not a human being. It's not a doctor. It's not a trained DDS DMD, right? That's going to come in and be able to
Yeah.
tell us exactly what is going on tooth by tooth.
Yeah.
So we still need the expertise of the human beings, but the
Exactly.
AI
Yes.
really helps from a conversation piece with patients, and where time is of the essence in
Mhm.
operatories, particularly in dental hygiene operatories where you're turning and burning patients, hour after
Mhm.
hour after hour. AI really helps me. Because let's just be honest, by the end of the day, my eyeballs and my body are more tired than they were at the beginning of the day. So it's really
Right.
nice to be able to flip that on, and I'm like, oh, I don't even have to think about it. It's just right there. There's all of our
And you
curious
just
lesions
just
being
look to confirm. Yeah, exactly. Yeah. And
fine.
it's always learning too, so with the help
It
of the
is.
providers, the AI is reading images, thousands and thousands of images on a daily basis, learning from those providers that are saying, yes, I accept this. Yes, I accept this. No, I don't accept this.
Mhm.
That's just going to help in that percentage of inaccuracies too.
Yeah.
So I like this case study. I believe in this case study. I think it hits home. 59% of patients are more likely to accept dental treatment recommendations that are backed by AI. So Vidya Health, that's who again we partnered with. That's our AI tool that we use within Dentrix Ascend. They ran a study that represented 1,047 adults in the US ages 18 and older. Nearly half of those polled were open to the use of dental AI if it could help either catch issues early or if it could reduce the need for a more invasive treatment in the future. That also circles back to the more invasive treatment, right? To what
Mhm.
Lisa's saying and all of her expertise. Listening to her talk about Curodont is just blows my mind. I love it. I wish I would have had this when I was working in a dental practice, right? But again, that just goes back to those patients that would rather, in most cases, accept try to prevent it beforehand before it turns into some drill and fill. People don't like that.
No. Who likes to get numb? Who
No,
who
and
who
even
likes
me,
the
and I know
sound of
what
the
they're doing.
drill? Who likes the feel or the sound of a drill? The benefit for the patient of this combining of AI with Curodont Repair Fluoride Plus, what's listed on the screen, you guys can just read through. I've already talked a lot to this, but I'll tell you just as a side note, something that has happened to me as a provider, just because I work in the same practices, on a pretty consistent basis, is that I would have patients coming back on time, shockingly enough, for their 6-month recall appointments, where in the past I had a very hard time getting them to be compliant with their recall. I like to think I'm a great hygienist, and I trying to motivate you to keep your gums healthy and not have bleeding gums when you floss and all these things. But I'll tell you what, integrating Curodont into our practice has made a difference on recall. Patients are coming
Mhm.
back in not because they're worried about their gum disease, but because they want to see if they have any more of those earlier carious lesions that I can treat with Curodont so they can avoid the drill or they can avoid the procedure that they don't like the most. So, while I thought I was a really good motivator and clinician, Curodont has definitely out motivated a lot of my patients more than I was ever able to. So it gives the patient a really positive experience. We're able to preserve their natural tooth structure by stopping the carious process in its tracks and reversing it. Like I said, it's a really short duration treatment. Thank you for Annie for bringing that up. It's very easy to add on as a same day treatment. It's
Mm-hmm.
considered not minimally invasive. It's considered completely non-invasive, non-staining. It's under the FDA fluoride monograph, so no reported side effects. So I love this little picture of the girl here. Vivardis has that as a poster that you could put in your operatory. You can ask any of your key account managers in the area for that. The future of oral health, no needle, no fear, no drill. Gotta love that.
And going back to talking about your son, there was a question in the chat. What about his diet? What was he eating, drinking, home care?
Yeah, I'll tell you, thank you so much for bringing that up
Yeah.
because for anybody who doesn't think that dental caries has non-modifiable genetic linked factors, I'm going to tell you right now, his sister is, well, they're not twins, but they're Irish twins. They're one
Mhm.
year apart, which means
Oh,
you got
that's right.
pregnant too fast and you had kids too close together. So I'm going to tell you right now that Braden and Brinley have the same diet. They have the same mom and dad. They always have. They have the same oral hygiene aids. They have the same access to all fluoride medicaments. I'm a dental hygienist. You can put me in dental jail all you want, but I put varnish on my son every 3 months in my house. And so his sister has never had a cavity ever in her life, not primary, not permanent teeth. She doesn't have any different diet or anything like that than my son, who has lived his entire life with dental
Mm,
caries. So the kid has every extra strength fluoride toothpaste, every water pick, every electric toothbrush. He's not sipping on sodas or prime all day long. I mean, he has them, but no different than she does. We have them with dinner, we have them with lunch. He's not sipping on it all day long. I have both very athletic children. They don't have any major medical problems. So, yeah, there are definitely non-modifiable factors that are at play in the Mayo household in my poor son's mouth. And I always tell him, I'm so sorry, honey, but you got mama's teeth because my teeth
right.
aren't any better than his.
Okay, last couple of slides here for you guys. I really wanted to touch on the profitability booster with using clinical AI in your practices. The next slide here, we do have a study, but this tool will indeed deliver better patient outcomes. It's going to elevate your patient care. It's going to also provide that visual component to show your patients. It's easy to not be a salesperson when you have AI and you can show what the technology is proving, right? So the study that I have here, this was done through Vidya. They did it across 400,000 patients at practices that are live in Ascend, right? And they discovered that the average practice could make close to 118,000 more per year in production as a result of using this technology. That's huge. That's that's amazing. So the study occurred over a 9-month time frame at 100 practices, and these were the results that we experienced. Lisa, you want to flip to the next?
Yeah, I was actually going to say, I
Yeah,
would wonder in that study, and it might be too late to go
yeah,
back and look, how many
yeah,
of them were actually doing guided enamel repair? Because there's been a
yeah.
couple of questions that came through the chat. You guys were asking about insurance coverage, how much you charge for the procedure, the ADA code. So the ADA code, because this is not CE credit, is D2991. It is under the restorative side, but as somebody was asking, can a dental hygienist perform guided enamel repair? And absolutely, any provider that can etch teeth can apply and perform guided enamel repair, but we still need our dentists to diagnose that procedure. So we want to make sure we're not applying Curodont to teeth that truly do need restorative interventions. People were asking about insurance. I always say the best way to figure out if insurance is paying for it in your state or on most of your insurance plans is to run an EOB and figure out if they are paying for it. I know where I happen to be in Texas, we charge our patients out of pocket for it, and then we file it to insurance for them. And if they're reimbursed, great, so be it. We'll be happy
That's
for that. Um, Medicaid is paying for this in certain states in the United States. So, typically wherever the federal government starts paying for things, the private sector is not long thereafter to follow. Somebody was asking how much you're charging, and that's going to be dependent on your third party contracts. If the insurance provider is paying for it and you're in network, you got to charge what they'll let you charge. If you're a fee for service, you could charge anything you want. I will say the fee for it is going to be more comparable to a one surface filling than it is
mhm.
going to be to a sealant. So if that helps you guys with the fees, that's the best way I can think to explain that. Oh, there's a
Perfect. And
study you
yes,
were talking
here's
about.
my study. Yes, yes. So
Yeah,
you can see the 20% increase post AI in net production for those particular practices that are leveraging this tool. Okay,
very nice.
perfect. Everybody can grab their phones, right, and take a copy of or take a picture of this QR code. Any additional information that you guys might be curious about, please go on here, enter your information in there. We can get you the details on what would it look like for you in your practice using the artificial intelligence on the images.
Nice. And I've got some QR codes for you guys too. So keep your phones out for just a second. For those that are interested in learning more about guided enamel repair and Curodont Repair Fluoride Plus, if you scan this, it'll take you directly to Vivardis's educational page. We do have a portion of our website that is solely donated to dental professionals. So it'll take you to a lot of those different studies. The systematic review is on there that I went over in this class today. That's where I found the video, Annie, that Dr. Wynn and I watched before we put
Oh,
Curodont on
nice.
the teeth. I went to Vivardis.com and typed in how to or something, and it just popped right up. It's a great website, super easy to find things on.
Thanks again,
Thank
Lisa and
you.
Annie.
Thanks,
That was
Lisa.
awesome.